Hello everyone, my name is Dr. Babatunde Okewale. Today I'll be talking about IVF. IVF basically means in vitro fertilization. In order for pregnancy to occur naturally, a woman produces the egg from the ovary, and during intercourse, the sperm of the man swims through the cervix and fertilizes this egg in the fallopian tube. That is the normal fertilization. But in IVF, what happens is the fertilization occurs in the laboratory, in the dish. And that is why it is called in vitro fertilization. In vitro in Latin means glassware. And it also means outside of the body. The fertilization that occurs inside the body can actually be called in vivo. In vivo means inside. So what we're talking about today is in vitro, outside of the body. Now, how did this come about? In the past, we realized that women who have problem with their fallopian tubes usually cannot get pregnant because of the blocked tubes. And people started thinking, how can we bypass the tube in such a way that the egg of the woman and the sperm of the man can meet outside in a fertilization, and the resulting embryo can be returned back inside the woman. This was achieved in 1978 in the UK, and the first baby that was born through IVF is called Louis Brown. That was in 1978. So who are the candidates that could benefit from IVF? The first kind of candidates are people who have tubal blockage. We already know that tubal blockage accounts for like 40% of all infertilities. Other candidates that could benefit from IVF are men who have low sperm count, and sometimes men who have no sperm count. Other candidates include people who have unexplained infertility. Unexplained infertility means you've checked everything and you don't know why pregnancy is still not occurring. It's useful in people who have endometriosis. It's useful in people who have tried all other methods of trying to achieve pregnancy. IVF is also useful in women who have advanced in age, especially women who are above the age of 38. So what's the process like? Basically, there are 6 steps in IVF. The first 2 steps has to do with stimulating the ovary of the woman. Normally, in a woman, she produces only 1 egg per month. But what we try and achieve during IVF is to make a woman produce more eggs. That is, we want to multiply stimulate the ovary. And there are some drugs we do give, some fertility drugs that can make a woman produce a lot of eggs. So that's the first step. We try and stimulate the ovary in what we call ovarian stimulation processes. During the process, we do regular ultrasound scans, especially the vaginal ultrasound scan, to monitor the size of the eggs or the follicles. We want to know the number of the follicles, and we also want to monitor the size. Another thing we check through the ultrasound scan is the size of the endometrium lining. This process, the ovarian stimulation process, could take anything between 10 to 14 days. When the eggs have reached a particular size, we will now give an injection, another injection. We call it the trigger injection. It's called HCG, to try and complete the maturation of the eggs inside the follicle. Now, what the HCG does is it completes the maturation, and it also loosens the egg from the follicular fluid. Once we give the trigger injection, it means we must retrieve the eggs within 36 to 40 hours after the process, after the injection, which brings us to the next step, which is the retrieval of the egg. Now, the egg retrieval is usually done about 36 hours after we've given the trigger injection, and it's usually done through a vaginal ultrasound scan. We call it ultrasound scan guided egg retrieval. And in this process, we empty all the follicles, and the fluid from the follicle is handed over to the embryologist, who will check and see how many eggs are in the follicle. That is as far as the egg retrieval process goes. It's a simple procedure. It usually takes like 15 minutes, and the woman can go home the same day. Once the eggs has been retrieved and the embryologist has confirmed that there are eggs in there, the embryologist will check and grade the eggs. On the same day, the man will produce the sperm. His sperm will be washed, it will be cleaned, and the good ones will be separated from the bad ones. The embryologist will now mix the sperm and the egg in the laboratory. The whole idea is that we want the sperm to fertilize the egg, and that is what is called in vitro fertilization, because that fertilization would occur in the laboratory setting. So that's the next step, fertilization of the egg. On the same day we retrieve the egg, the sperm is mixed with the egg. Now, there are two types of IVF. We have the classical IVF, in which case the egg that has been retrieved is just mixed with the sperm that has been prepared, and we wait for the sperm to fertilize the egg. There is another type called ICSI, intracytoplasmic sperm injection. In this case, what we do is we pick the individual sperm and inject it directly into the egg so that fertilization can occur. We sometimes do this when the sperm count is very poor, especially when it is less than 5 million. The next day, the embryologist will go and check all the eggs that he has injected the sperm with and see whether fertilization has occurred. If fertilization has occurred, he or she will now wait and see whether the fertilized egg will start dividing. When they start dividing, usually the next day or day after, we say embryos have started forming. Which brings us to the other step, which is the embryo transfer. The embryo is usually transferred back into the woman anytime from day 2 to day 5 after fertilization. We try as much as possible to make the transfer a day 5 transfer, which we call the blastocyst transfer. Why? Because it gives the best result. Don't forget, the fertilized egg and the embryo are growing in the lab in an incubator that we call CO2 incubator. On the day of embryo transfer, which basically is the second to the last step in the IVF process, the woman is invited to come into the hospital, and the embryos are loaded into a small catheter, a thin catheter, and then we just transfer it directly inside the womb to continue its growth. So that is the embryo transfer. We usually advise the woman to rest for a few hours after the embryo transfer, and then she can go home. And then we wait. The last stage of IVF is the waiting period. That's 2 weeks after the embryo transfer. We call that the luteal phase stage. It is that stage where the transferred embryo, we assume, should have started to implant and start growing inside the woman's body. During the luteal phase, there are some drugs we give called luteal hormones, especially called progesterone. What this hormone does is it prepares the inside of the womb. The 2 weeks wait is one of the most emotionally charged period for a woman, because it is after that 2 weeks that we do the pregnancy test and know whether the whole process has been successful or not. So in a nutshell, that is what IVF is. If you want to know more about this, I will advise that you get my book. It's called How to Get Pregnant and Have a Baby. It's available at Amazon. Thank you for listening.